certain kind of innerwear or certain kind of drinks, coffee, tea, can cause breast cancer. Is that true or false? So they are called precancerous lesions, lesions on the body which can turn into cancer soon enough, which the common public should know about. How often should they be getting it done?
You should get it done every 3 yearly or perhaps year.
Its deficiency has been linked to almost every disease out there in the medical textbook.
Yes.
Which is that one cancer which has like the best success rate with treatment, and which is that one cancer which has the worst success rate even after all the chemo, radio and whatever you do. Hello and welcome to Aditi Shah Talks. I'm Dr. Aditi and I bring every episode with specialists and super specialists just for you guys. If you're a follower, then you must be knowing the kind of quality we deliver in such a short span of time. And if you're a new viewer, then you are in for a treat because we are going to be debunking some important myths on cancer, a field that even doctors find it difficult to study. So just for you all today, we have one of Mumbai's topmost oncologists, Dr. Kunal Jobanputra. Hi Kunal, welcome to the show and thank you for coming.
Thank you for inviting me. Although cancer is a broad topic, but we will try to debunk some of the myths today.
Alright, so Kunal, first let's dive into the most common myths that patients have in their mind about cancer. I'll mention a few statements. You just tell me whether it's true or false. Okay.
Sure.
So the first one being that almost all cancers are genetic or hereditary.
Yeah. So that's a completely false myth because if we see the cancers distribution, almost just 10 to 15% of cancers are hereditary or having a genetic basis to it. Rest of the cancers are related to some or other factors, which could be your addiction patterns or lifestyle factors, stress factors, dietary factors. These are the few factors which can lead to cancer, and this contribute to the preventable causes of cancer rather than just cancers being attributed to a genetic or a familial basis.
So you're trying to say that even though some cancers may be hereditary, still there is a way to prevent them if you follow certain lifestyle modifications,
Yes.
right?
Yes. It's a common thing that patients usually say that there is no family history, still I am getting a cancer. So only 1 in 10 would have a family history.
Yeah, so people always say कि अरे मेरे पापा को या किसी को घर में हुआ नहीं है लेकिन मुझे कैसे हो गया. So they always think कि lifestyle modifications were not that important.
Yeah.
It was just the genetic factor that was important. Cancers are mostly found in the elderly age group or they are quite common in the younger age group also.
So if we look at the distribution of cancers, cancers are known to be associated with increasing age. But having said that, there are cancers which typically also occur in the young pediatric population. There are cancers which occur in the adult and the young population.
And they are quite common?
They are quite common. So in pediatric population, we see cancers which are blood cancers or neural cancers, okay, or bony or soft tissue cancers. Okay. If we go to an age of around 15 to say 40 years of age, this is an adult and young adult population. There you see testicular cancer. Then you see lymphoma, which is type of a blood cancer, which is completely curable. So the spectrum of cancers distribution changes as we shift from one age bracket to another. Okay. Also, there is a recent concept of early onset cancers. So cancers which are typically known to occur in 60s and 70s, if they occur before 50 years of age, that is because of our changing lifestyle and changing environmental factors.
Okay, what kind of environmental factors?
So it ranges from your smoking or alcohol patterns to environmental pollution, to your sleep and stress factors, which are not proven, but they are scientists are trying to prove it, to exposure to the environment like microplastics and pesticides, all those things. These are the few of the factors which are contributing to early onset cancer, also are linked with some of the cancers.
So people usually connect chemotherapy to something that is too scary or, end of life kind of therapy. There's kabhi kuch bacha nahi hai kind of. So can you just enlighten the audience about chemotherapy?
Yeah. Previous times, before I would say 4 or 5 decades back, where the treatments were not so modern, or I would say the ways to deliver the treatment were not so modern. For example, if I give chemotherapy, there are high chances of patient having multiple episodes of vomiting in a day. Okay. Right, or landing up with a fever because of his or her blood counts have dropped significantly. Okay. Now with the better supportive care, better molecules or better ways of delivering the same molecules in a different formulation, that has improved the tolerance of patients tolerating chemotherapy drastically. The chances of patient landing up with severe vomiting is less than 10% now with proper precautions and medicines. There are ways to reduce the incidence of hair loss by employing scalp cooling. There are ways to
scalp cooling is it?
Scalp cooling is a technique where a patient is typically worn a helmet before, during, and after the chemotherapy infusions for chemotherapies which are known to cause hair loss.
Oh, interesting.
So the principle behind it is it reduces the blood circulation to the scalp during the chemotherapy. So because the blood vessels are constricted, the blood circulation to the hair follicles is reduced during the chemotherapy, and that's how the concentration of chemotherapy reaching up to the scalp and the hair follicles is a bit lower. So it works in around 40-50% of patients. It helps in reducing the intensity of the hair loss and also helps in getting your hair faster in terms of regrowth. So that is the help of scalp cooling. Also, how does chemotherapy improve our life? So in curative cancers, if you are giving chemotherapy, it helps in improving our life and curing the cancer altogether. For example, breast cancer. If you are in stage 2 or stage 3 breast cancer, early breast cancers, chemotherapy can cure your cancer along with the help of surgery and radiation, leading up to outcomes up to 80-90%. If you don't take chemotherapy, the outcomes are not so good. In those cases, you will be ending up with a recurrence, right? Now, if we talk about metastatic disease, because of chemotherapy, patients are even living up to 5-6 years in certain types of cancers.
What do you mean by metastatic diseases? Can you just explain?
Yeah. In cases where disease has spread to other parts of the body, for example, a breast cancer has spread to the liver or lung. In those cases also, chemotherapy, and also nowadays there is something known as targeted therapies or precision therapies. These have helped to improve the outcomes of staying alive previously, which was considered a miracle. Now patients are also staying alive for 5 years, 7 years altogether.
So you're saying stage 4 cancers have increased lifespan now than before.
Yes, and this is all because of chemotherapy. However, at some times when patient is really frail or very weak, then the oncologist usually decides if patient can be given a lower dose of chemotherapy because the risk of side effects outweighs the benefits. Oh,
okay. So in thin individuals, chemotherapy can be a little dicey versus somebody who's well built.
Yeah.
Okay. All right. So since you mentioned breast cancer, my fourth statement, certain kind of innerwear or certain kind of drinks, coffee, tea, can cause breast cancer. Is that true or false?
So it's a false statement, and commonly people associate usage of deodorants or antiperspirants or certain kinds of innerwear to development of breast cancer, but none of these have been found to be.
Even those silicone.
Nothing has been found to be associated or leading to increased risk of breast cancer.
Oh, okay. That's good to know.
Yes.
And there's a lot on social media about sugar and cancer. People think that by cutting down on sugar in their life, they will be reducing their chances of cancer, also thinking cancer feeds on sugar. So is that true or false?
So that's again a false statement. So if we talk about sugar, so excessive sugar is not just linked to cancer or its development in common terms, but if you say scientifically, it is also having harmful effects on our overall health.
Correct.
Cardiovascular and all other factors. Now, if we talk about patients having cancer and what should be the sugar intake, so we should see what kind of sugar it is, right?
Okay.
If it is derived from natural sources or whether it is artificial sugars or like what you say, high fructose corn syrup and all those kinds. So those are excessively rich in sugar, which can cause a very high spike of sugar in your body. Because of the high spikes of the sugar, there are certain hypothetical statements or hypothetical arguments that because of the high spike, there is an increased production of insulin growth factor, which can potentially lead to development of more spread of the cancer. But that has not been even scientifically proven. So what I advise my patients is that you take sugar in moderation, try to get it from natural sources, fruits, your dairy products are the best ones. Jaggeries. So this because of the
even the normal sugar that we get, right? That's from sugarcane itself.
So patients can come if they want that one fine day they walk down a cafe and want to have a slice of cake. That's absolutely fine.
Yeah.
But then the excessive sugar like in confectionery, bakery, or the artificial beverages, sweetened beverages, that are a bit harmful if taken in excess amount. And also one thing that if we put lot of restrictions on a patient, that don't eat this, don't eat that, even during chemotherapy and whatever therapies or surgeries the patient is on, we don't want such restrictions which would hamper the patient's food intake, because that is required to maintain the weight of the patient, also to keep the tolerance of chemotherapy or whatever treatment is on. A patient's fitness should be robust. Yes. So I would not like to restrict someone's oral intake. If you stop smoking or if you don't smoke, then you will not get cancer ever. Is that true? Again, that's a false statement. If we look at the Western population, 10 to 15% of lung cancers are occurring in patients who have never smoked. Okay. But if you see in India, in the Asian population, around 30 to 40 or even up to some series claiming up to 50% of patients with lung cancer have never been smokers. Oh. Right. Okay. So it's not always necessary that a smoking history should be present to have for someone to have a lung cancer, right? Yeah, but then obviously we don't advocate you smoking, because smoking is harmful in any other way, not just causing cancer, but all the other organs of your body do get affected. I'm sure people already know that. So to add to that, smoking is still the most leading cause of lung cancers and many other cancers and many other health issues. And even if someone stops smoking, the risk for development of cancer persists for 10 to 15 or 20 years together. Oh. It never returns to zero. The cancer risk might reduce to 50% compared to what when you are actively smoking, but it never reduces to zero. Okay. And still, if you have a history of smoking in the past, say 1 or 2 decades past, still you are 3 to 5 times at higher risk of developing a cancer than a never smoker. Oh, okay. That is really interesting to know. Fine. What about apple cider vinegar being so much in news for curing cancer or dissolving the cancer? Yeah. What is your take? It's not a new thing. Just because it got highlighted by a few public figures and also one of the series on a web series. So the basic idea of apple cider vinegar is that it contains acetic acid as one of the components, along with polyphenols. Okay. So there is a theory that this can destroy the cancer cells. However, by modulating the pH of that is the acid or the base level of the blood. Okay. But body is not so simple in terms of modulating the pH. Body has got its various nice robust ways to maintain the pH irrespective of whatever you eat. I would not suggest it. It's not conclusively said to affect or lead to cancer cure. We also need to remember certain harmful effects of apple cider vinegar if taken in excessive amount. Like for example, it can lead to tooth decay. Okay. Or it can lead to excessive can lead to ulceration or some gastric or esophageal burning. Yeah. Or it can harmfully reduce your potassium levels. So these are the things which we need to keep in mind if taken in excessive amount. That's something very important to know, because a lot of people take apple cider vinegar to get some kind of a glow on the skin also, and they should know that it causes these side effects. Cancer always is associated with some kind of a sign or a symptom, like say pain or maybe loss of appetite. Is that true? Again, it's only partly true because many of the cancers, like for example thyroid cancers, prostate, kidney, and many others, they don't have even any signs or symptoms. Okay. They are usually diagnosed when you are getting investigated for some other thing. For example, during the COVID times, there were a lot of chest CT scans being done, right? So previously we never used to do so many CT scans like we did in the corona period. So doctors picked up a lot of small incidental 1 or 2 centimeter lung nodules lying here and there, which turned out to be malignant. Other things said because the CT chest also covers your kidneys. So there are some masses which are lying in the upper pole of the kidney, upper part of the kidney, which gets picked up incidentally. Okay. So the most common presentation of a kidney cancer is incidental. That is, you are never visiting a doctor for that kidney cancer, but you are visiting a doctor for some other purpose and you get diagnosed with a kidney cancer. Similarly, prostate cancers. They are also quite lying indolently in our body till someone does an autopsy.
Oh.
So most of these cancers usually present without any symptoms also.
Yeah, so even they won't even have much weight loss, you mean to
Yeah.
say. They will just be like normally how they were
Yeah.
without any special signs.
And it also depends on the stage of the cancer that time. If the cancers are advanced, then they usually lead to symptoms. Or if the cancers are very superficial, like for example a breast lump, that would easily be picked up. Or a skin lesion or a melanoma or some cancers like that. But if the cancers are in the abdomen, then a liver cancer or intestinal cancer usually doesn't get picked up until that gets advanced, leading to probably some jaundice or reduced hemoglobin levels or blood in the stools.
Okay. So the progressive ones are the ones that get picked up. What about the hereditary cancers? Amongst the cancers which are hereditary genetic, at what age should the children get screened? Not just children, everybody in the adult population gets screened if their immediate relative has had a particular cancer. Is there some kind of a protocol for certain cancers?
Yes. So the most common hereditary cancers, if you say, then these are the breast, ovarian, colon cancers. These are the 3-4 types of cancers where there is a lot of hereditary association, and also some guidelines to how to
mostly
approach.
Females have been targeted with hereditary cancers.
So it's not like that. Even males have got the prostate cancer also has got a hereditary association. So if someone in a family has got first degree relative, that means your mother, sister, daughter who is having for example, say breast cancer or ovarian cancer, then that person should also seek genetic counseling. That means to understand the benefits and also the repercussions of getting yourself checked for that particular gene if you are carrying it. If someone is willing to undergo a genetic testing, then and if he or she turns out to be positive, then there are protocols of how to get yourself screened. For example, if a daughter of a patient having breast cancer is also positive for one of the gene which is known as BRCA, BRCA1 or BRCA2, then there are guidelines like doing repeated screening by means of mammogram with MRI of the breast, starting at an earlier age of 30, instead of what the screening usually for normal people is at 40. So that's how we intensify the screening to pick up the lesions at an earlier stage compared to the routine practice. Also, in general, if sometimes all cancers might not have a particular genetic mutation to blame that entity. So in those cancers, if you have a history or a significant history of multiple people landing up with a particular cancer, then you should get screened for that cancer at least 10 years early compared to the first onset of the cancer in your family. So what I've understood is a 10-year period is quite the number to get screened earlier, right? Now, Kunal, if there are certain specific bodily signs or lesions which could predict cancer, so they're called precancerous lesions, lesions on the body which can turn into cancer soon enough, which the common public should know about, then now they need to visit the oncologist. So can you just enumerate those few of them? So precancerous lesions are conditions in which the cells have become abnormal, but they have not multiplied to an extent or spread to an extent to call them it a cancer. So there are certain things, certain lesions. For example, the most common in our country because of the usage of tobacco is leukoplakia or erythroplakia. So in common terms, it means any whitish patch in your oral cavity or any reddish patch which is there since long. I'm not talking about just normal oral aphthous ulcers like we get because of our lifestyles and stress, which usually gets disappeared in a week or two. But if there are whitish patch or reddish patch in your oral cavity and with a prior history of recurrent tobacco usage, along with restriction, that is poor opening of the mouth, that is submucous fibrosis, then you should go to a doctor to get it examined or probably do a biopsy to rule out cancer. Another example is of precancerous lesion are certain skin lesions. Actinic keratosis is one, which is a discolored patch. Or there could be change in the warts, pre-existing warts. So
Okay.
if someone is having a mole or a wart since long, but if there is a sudden increase in the size, or there is any bleeding or any cracks development on that, or
Oh.
discoloration of that, then
Okay.
you should see a oncologist or a physician to check out. Other precancerous state is also cervical dysplasia.
Okay. What happens in that?
That is one step before development of a full-blown cervical cancer. So in India, cervical cancer is unfortunately very common because of increased transmission of human papillomavirus.
Okay.
So we have vaccination for that, and everyone should get vaccinated for human papillomavirus. And
Men and female included.
yes.
Yes.
So before cervical cancer development, there is a state which is cervical dysplasia, which gets picked up on a pap smear or a HPV test.
Okay.
And if we have that condition, then we can increase the
So
screening.
that would get picked up only on a
On the
pap
pap
smear.
smear,
So
yes.
why would they go for the pap smear in the first place?
So pap smear has to be done. It's a part of a routine screening for every woman who is the age of about 30 years and above, till you are at elderly age.
Okay.
You should get a pap smear done.
How often should they be getting it done?
You should get it done every 3 yearly, a pap smear.
Oh, okay. All right. That's important to know. Kunal, if there are certain foods out there which should be strictly avoided, because they can cause cancer, and there is enough literature about it, which are those foods which Indians should be avoiding?
There is not much of scientific literature on the direct causation of certain foods linking to cancer. But in general, if you say, then foods which are high in preservatives or excessively processed foods, canned foods, foods which are high in calories, as we discussed.
Canned foods, okay. The ones which people eat abroad, but not so much in India.
So these are the ones usually which are high in certain chemicals or preservatives, or excessive calorie or high content of sugar, which can cause a very rapid and abrupt sugar spike. Those are the ones we should avoid taking excessively. Okay, so excess chemicals, preservatives, and sugars is something that probably lead to cancer. But however, this is defined. And then there are certain foods which also we should know, which are very protective, right? In general, not just cancer. That foods which are high in antioxidants, high in vitamins and minerals. So these are the components or chemicals which help the body against the wear and tear of the body. Yes. But which vitamins are we looking at? So these are all micronutrients which I am talking about, in addition to normal vitamins which we know. For example, vitamin D deficiency has been studied if it leads to development of cancer or progression of cancer. So vitamin D is also very important. Yeah, I think that's one of the most important vitamins because it's been linked. Its deficiency has been linked to almost every disease out there in the medical textbook. Yes. Okay, one final question, Kunal. Which is that one cancer which has like the best success rate with treatment, and which is that one cancer which has the worst success rate even after all the chemo, radio, and whatever you do? So I would not just name one cancer. I will name a few cancers which are having the good success or best success rate. Like for example, thyroid cancers, these testicular cancers. So previously, when chemotherapy was not there for testicular cancer or for lymphomas, which is one of the type of blood cancers, the outcomes were so poor, which would be just 20-30% success rate. But now the success rate has gone beyond 90%. Okay. Right. So lymphomas, testicular cancers, thyroid cancers, early prostate cancers. These are the ones which are having more than 80 to 90% success or outcomes. But probably the not so good ones are the cancers, usually the pancreas, pancreatic cancer, liver cancers, the abdominal cancer, other like gastric cancers or esophageal cancers, also brain cancers. Okay. So these are the ones which have not so great outcomes. But now the things are changing with the advent of something known as precision oncology, where you treat each patient differently according to the genetic changes in their tissue. So there have been miracles where you find some mutation for which you have a target, and even the poorest outcomes cancers patients can live longer for many years. All right, thank you, Kunal. I think we had a great conversation on cancers today. And Kunal was just mentioning that now he's so hungry, he's going to go down and have processed foods only. But thanks a lot, Kunal, for taking out time for my podcast. We are very grateful. Thank you. Thank you for inviting me. Thank you.
So if you guys have found this video useful, please hit the like button and share it with someone who may need it.